Dear colleagues, let me introduce for your attention the report Assessment of Theoretical and Practical Skills for Students on Traumatology and Orthopaedics using Artificial Intelligence Features. So both theoretical and practical skills are essentially important for such clinically oriented discipline as traumatology and orthopedics. And they should go along well, as a lack of each of these components may result negatively on professional competency. So the study we performed was aimed to analyze the results of our teaching activity for students of 5th year on subject traumatology and orthopedics. We analyzed final total score for 3 faculties: medical, medical psychological, and medical pharmaceutical. We used artificial intelligence features of Copilot in Office 365 to analyze our results. So totally there were 72 students involved in the study. There were Ukrainian and English-speaking students. The theoretical skills were assessed using the multitask test, which was uploaded to Yes Vita University website. It includes 30 random questions, and there were 20 minutes given for each student. The practical skills were assessed during oral examination according to such criteria as X-ray diagnostics, patient's curation, case history writing, performing first medical aid, and choosing correct treatment plan. Each practical skills criteria gives maximum of 10 points, and theoretical skills tests gives maximum 30 points. So the maximum total score for each student was up to 80 points. The average scores for students' teaching activities was presented as mean and standard deviation, and we also calculated correlation coefficient between practical skills criteria and theoretical knowledge. For this purpose, we used Python script using deep analysis with Copilot. The average score was the highest for medical faculty. It was 64.4, and the lowest score was for English-speaking students from medical pharmaceutical faculty, 52.6. The assessment of X-rays criteria showed us that it contributes mostly to the final module score, and the highest values for this criteria was for medical faculty. It was 8.6, and the lowest it was for medical pharmaceutical faculty. It was 5.7. So we also calculated the correlation between practical skills criteria and theoretical knowledge. So the highest correlation was for such criteria as X-ray assessment. It was 0.42, and writing the case history, 0.44. For other practical skills criteria, the correlation was lower, and the lowest it was for such criteria as performing first medical aid. It was 0.14, but still shows positive correlation. So we should conclude that both theoretical and practical knowledge are essentially important for further clinical practice of physicians, and they should be assessed well at the end of educational course. The correlation between different components of practical skills and theoretical skills shows the importance of each aspect of students' education. And such useful tools as multitask task tests on YesVita website, and Copilot artificial intelligence features allows us to check, to assess students' level of knowledge quickly and to analyze these results. Thank you very much for your attention.